Now, without further ado, I would like to invite Associate Professor Dr. Harif Fazilah bin Cik Hashim to introduce our keynote speaker for today, Datuk Dr. Hishamshah bin Muhammad Ibrahim.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to welcome Yang Berbahagia Datuk Dr. Hishamshah. Selamat datang Datuk to our Medical and Health Sciences Conference 2021. Datuk Hishamshah will present the keynote address, COVID-19 Embracing the New Paradigm. Before that, let's give a short CV about Datuk. Datuk Dr. Hishamshah Muhammad Ibrahim is currently the Deputy Director General of Health, Research and Technical Support, Ministry of Health, Malaysia. He is also a Senior Consultant Pediatrician and Consultant Pediatric Hematologist and Oncologist. His clinical responsibilities and research interests include childhood malignancy, stem cell transplantation, hematological disorders, and infection in immune-compromised patients. He received his professional degrees from the Universiti Kebangsaan Malaysia, UKM, and his pediatric career has spanned positions in Malaysia, Australia, and the United States of America. Besides formerly heading the pediatric department, he was also the ministry's National Head of Pediatric Services, charged, among others, with the clinical administration, training, planning, and development of the pediatric clinical services for the whole country. He was also an honorary lecturer and research supervisor for several postgraduate medical programs of several universities and allied health training programs, and has published numerous articles in peer-reviewed medical journals, book chapters, and other medical papers. He is active in both industry and investigator-initiated research, and has participated in presentations at medical conferences in Malaysia and internationally. He is an active member of several professional medical societies and non-governmental organizations, including serving for many years as past president of the Malaysia Society of Pediatric Hematology and Oncology. Now, without further ado, I would like to invite Yang Berbahagia Datuk Dr. Hishamshah to deliver his keynote address. Bagi Datuk, the floor is yours. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Good morning. Professor Dr. Asmadi Muhammad Naim, Vice Chancellor for the Universiti Islam Antarabangsa Sultan Abdul Halim, Muazzan Shah, UniSHAMS, as the patron for the first Medicine and Health Sciences Conference 2021. Associated Professor Dr. Harif Fazilah Cik Hashim, the Dean. Associate Professor Dr. Muhammad Fauzi Abdullah, Deputy Dean. Dr. Nur Maizatul Afiza Ismail, Director of Medicine and Health Sciences Conference. Chairperson, organizing committee members, distinguished speakers, academicians, specialists, guests, graduate students, ladies and gentlemen. First of all, I would like to send regards from Tan Sri DG and the team here from Kementerian Kesihatan. Couldn't make it because we've got a parliamentary PAC session this morning. So they are in Parliament. So I'll just go quickly through what maybe I could share today with you regarding the pandemic, embracing the new paradigm. We've got another session, I think, and one of my colleagues is going to probably go into more detail with regards to the COVID-19 vaccine program, efficacy of the COVID-19 vaccine. That would come probably in the other session. Well, as most of us are well aware, we are currently in the midst of a pandemic. I don't have any prepared slides. I'm just going to probably speak off the cuff. Yeah. So the pandemic has now involved the whole world, and we have been, affected from the global level, and then from the national level, society, professional, individual, organizational, and this has actually impacted us in many ways. Unless we are able to embrace the new paradigm of living, so it's going to set us back in many other ways, yeah, in many ways that can be very unproductive, yeah, and this is something that a lot of organizations are not prepared with, yeah, and as the new reality of the pandemic sets in, organizations and individuals would grapple with the implications of the virus. Well, in the short term, organization generally would be engaged in very empathic pro-employee responses, and many have radically altered how and where employees work. For example, in the way we handle meetings, we are told to conduct a lot of our meetings now in VC by virtual conferences, and a lot of webinars and a lot of conferences now are not physical conferences where you come by together in a big hotel room, but now it comes with VCs, web conferences, webinars like this. So this is the new paradigm of how we have radically adapted in conducting interaction, and it took a lot of people by surprise, and even the way we conduct lessons in the universities as well as in schools, it is being conducted in a virtual environment, and this has given the country and a lot of people a lot of challenges, because the technological platform is not readily available to everybody, and this is the reality that a lot of people have got to be content with, yeah, and a lot of these changes needs to be undertaken in such a short period of time, and a lot of people are being left behind. So we are concerned about the lost generation of our people who could not adapt quickly to the changes that comes so suddenly, yeah. And so the paradigm shift is a fundamental change that underlies this phenomenon, and a lot of research are going to be done going forward that would show the positive and the negative that has resulted from this very fundamental change. A lot of times that I was just going to go through what's happening in the country, that when we first grapple with the COVID-19 pandemic, the first instance, the first issue that we need to be grappling with is in terms of saving lives, yeah. And the other thing that we also need to be content with is livelihood. You need to have you need to be alive before you can actually have livelihood. So if you reflect back on how we handle the second wave, the first wave and the second wave, when we first had this outbreak of the pandemic within our shores, we introduced the Movement Control Order, the PKP 1.0. At that point, our main concern with this new pandemic is how do we save lives? So at that point, the Movement Control Order is quite total in character. People are not allowed to move outside their homes except for emergencies and for critical reasons, or searching for food and other essential services. And only essential services or industries are allowed to operate. So because at that point, the balance is more towards saving life, yeah, rather than livelihood. But as we move along, and when we see that the cost to maintain life is actually quite high, so there's some leeway, there is some slack given to livelihood. So there is some opening up of more industries, opening up of movements, and because of that, you cannot avoid the issue of getting the transmission into the community. So that's how we change from MCO 1.0, MCO 2.0, MCO 3.0 the differences in the enforcement of the movement control order, the public health intervention is less severe or less, draconian in a sense, because we need to have some balance of making sure that the economy is not affected. Yeah. So looking at what happens with a lot of our colleagues, out there, and a lot of our people in Malaysia, as well as the rest of the world, there is issue with, the non-availability of jobs. People are being unemployed because of lack of economic sector movements in the economic sector. Yeah. And prior to the pandemic, we've got a lot of people challenged with a lack of employment in some countries. But with the pandemic, you can see that the percentage of unemployment has reached historical low and nearing probably the depression level, of bygone years. Yeah. And so this is where some industries are really affected, and a lot of people are without any take-home pay. And but on the other hand, some industries are getting a windfall out of this pandemic. For instance, industries that are reliant on that are involved in the telecommunication sectors are booming, because before the pandemic, not a lot of people are aware of the use of video conferencing platforms. But now, with the advent of the pandemic, Zoom has actually boomed, and Google Meet and Microsoft Teams, and a lot of this web conferencing and the telecommunication sectors has actually been booming, very high load of business and requirement to increase the bandwidth and availability of a lot of this video conferencing platform. With that, the paraphernalias involved in telecommunication are seeing increasing demand. So these are some of the things that have changed with the pandemic. Yeah. But on the other hand, you can also see a lot of industries that certainly has been impacted significantly. For instance, travel industry, they are totally stopped at some stage, and it's going to take them many years before they can actually get back to the pre-pandemic level. And also restaurants, who are very these are industries, service industries, that are very reliant on people coming to patronize their their restaurants, their place of business, has been severely impacted as well. But on the other hand, you see that the service delivery, Grab, and then those that can actually meet the needs of delivering services or groceries or food to residences, to place of employment. So these are the industries that started showing a lot of promises. So this is something that is very peculiar about the pandemics, and when you see the supply chain with the pandemic, with the open global economy, you see that with the pandemic, lockdowns in one country has a ripple effect to businesses and factories in other countries. Because prior to the pandemic, certain sectors or certain components of some industries are being developed or manufactured in other countries, and they need a very good supply chain delivery platform and services to make sure that this is in a seamless manner. But with the pandemic, with the lockdown, we noticed that this have also put all of this system in disarray, and so much so that sectors who rely on a seamless way of handling the supply chain are affected as well. And it has taken a lot of time before this movement of goods are being allowed, and before these economies and these industries can come back to some semblance of normalcy. So these are the kind of things that happens during the pandemic that we should be very very well aware of. Yeah. And of course, when you see about the effect of life and livelihood, so the impact of the livelihood issue has got very direct bearing on the financial implications. Yeah. And before the pandemic, a lot of the economies are showing challenges because we've got issues with a lot of financial setback before the pandemic. But with the pandemic, they seem to get worse. Yeah. And with the lower unemployment, and we can see that a lot of these issues of how can we make sure that the financial sector and the economic outlook can get better as we go along is something that all countries have got to consider. Yeah, in Malaysia, hundreds of billions are being invested during this pandemic so that we can pump prime and make sure that the economy stays relevant, stays fluid, that the economy can actually sustain during this very bad patch, so that it can be can take off in a better state once we see the light at the end of the tunnel. And in some industries that has actually shown very increasing demand. For instance, our glove industries in Malaysia have seen a windfall kind of opportunity, whereby they have billions of profit because of the demands from these glove industries. And of course, a lot of other medical supplies industries have seen an uptake, and a lot of these industries are making huge profits. Reagents, test kits, it's all seeing a lot of industries coming up, and you can see literally hundreds of RT-PCR test kits, RTK antigen test kits, and now we've got the self-testing test kits. So, meaning to say, if people can take opportunities during the pandemic and supply services which are quickly in need during that time, these are the industries that are nimble enough, that can actually derive profit, and they can thrive during such challenging times. Yeah. And even in Malaysia, we are noticing some of these industries trying to put up shop in Malaysia. For instance, some of the medical device and testing industries. But by and large, if you look at the financial health and financial outcome from our local industries, it's not as much as can be if you compare this to what's happening in some industries, like industries in China or South Korea or the other countries, where they can quickly come up with the test kits, and they can sell to the export market to meet the demands of this current pandemic. So the short-term incentive financial stimulus given the government is quite sizable in Malaysia. We hope our local industries can weather the storm during this immediate and short-term period, but we are going to see a long haul before a lot of our industries can reach the same level of efficiency pre-pandemic. And we need to be self-reliant. We know that early in the pandemic, it is not an issue of not having enough money. We even in the Ministry of Health, we can reflect back whereby at one stage we are seeking for ventilators. Although we have the money, but the ventilators are all being booked by other countries, especially in Europe at that time, whereby, you know, for instance, in Italy, in some parts of Europe, where their hospitals are swamped with patients requiring a lot of ventilation. And when we want to buy ventilators, we can't source the ventilators because it's all being booked by the other countries in the world, and they're giving a very good price for them. And even for some countries that have developed their industries locally, some components of the products are being, you know, exclusively directed to the companies in our country, not to sell them locally, but to ship it back to their country of origin. So they may have the factory here, but the products that is being produced in our country could not be sold to our country because their country of origin, those investors want this product to be reserved for their country. So these are some of the you know, things that we need to look into, because in future we need to make sure that we are self-reliant in many aspects. We must be self-reliant in a lot of these essential services, essential goods, essential drugs. Even for some of these drugs, a lot of these drugs, we need to import the product from overseas. And at one point, India is actually, you know, not allowing the export of certain drugs. So this is a wake-up call for us to make sure that we are sufficient in future. Should another pandemic hit us, we need to be sure that, you know, we are ready. So in this regard, for instance, in vaccine production, in this regard, we have begun to look into developing the local capacity of developing our own vaccine. Alhamdulillah, at the moment, IMR have got 2 candidate vaccine that is in the preclinical stage, and we are going to test this out in animals to see whether is it safe, and then looking at what is the dosing that is required, and before going into clinical trials. Because we think that at this moment, the pandemic is going to evolve into an endemic. So at the moment, our immunization rate is quite remarkable. We have seen, I mean, in terms of the vaccination rate, we are up there, the top in the world in terms of ramping up the immunization for a whole country. I think by the end of the 31st August, we hope to have vaccinated half of our adult population by then. Yeah, when we have vaccinated about that sizable number of our population, we hope to see the number of people who are being admitted to the wards with a higher severe category of the disease should be coming down. This we can see in Labuan and also as well as in Sarawak, where their percentage of vaccination have increased beyond 50%. I think now in Labuan is beyond 80% that has been completely vaccinated, and the number of cases that were admitted to the wards have significantly come down a lot. Yeah, they've got only a few patients with COVID-19 in the ICU, for example. So we hope to emulate this elsewhere in the country. So this is some of the positive thing that is happening country nationwide. Yeah, we hope by Merdeka Day we can have we can share the good news to everyone in the country. So I've spoken about job security and how the pandemic has caused a lot of issues with regards to availability of jobs. And secondly, I've talked about the paradigm shift in terms of the financial implication. We are in recession at the moment, the whole world, and we need to sustain this for a period of time before we can really get back to economically grow our country. And with that, we have actually, the government have spent a lot of money as a stimulus package to sustain the economy. And also the way that we do things remotely is going to be enhanced further post-pandemic. So these are the new norms. So although the vaccination program is showing a lot of positive progress for the past many days that I can remember, it has gone beyond our initial estimate. We estimated that probably we could vaccinate maybe about 200 or 300,000 persons per day. But, you know, the past couple of weeks has shown that we can pick up to more than 500,000 per day. If we can maintain about 400,000 vaccination per day, so that is when we can really see a sizable proportion of our adult population are going to be vaccinated. But although you are being vaccinated, but that does not mean that you're not going to get the infection if you're exposed to high viral load. For instance, now we've got the Delta variant, which has a much higher viral load than the original strain. The original Wuhan strain, the R0, the reproducibility number, the infectivity is probably maybe about 2.5 to 3. But the variant, the Delta variant, is double that. It can be as high as 6. And some public health specialists are saying that it is as infectious as chickenpox. So because of that, despite having vaccinated, people must be aware that we still need to adhere to some of the SOPs that we have introduced. For instance, we still need to probably wear a mask in indoors, or where you've got a lot of confined space where there are a crowd. Then it is common sense for us to actually use face masks. And there are signs to say that it can prevent the transmission of infection. Yeah, you still need to probably do some social distancing, and then you still need to make sure that we wash our hands. And these measures must be still kept in place despite having vaccination. Yeah. And this is what we saw happening in the Western countries that has higher rates of vaccination, and they have lifted the restrictions so soon, and you can see the uptick of infection. But having said that, although there's this uptick of infection, the new cases of infection, but the cases that got admitted to the ward remained low, and the number of deaths correspondingly are also not high. So this gives to the credence to the fact that the vaccination will protect you from severe disease, but the vaccination may not protect you 100% from you carrying the virus, getting infected, and also transmitting the virus. So that is something that you need to be content with. So because of this, there is this paradigm shift for all sectors in the economy that you need to probably do a lot of remote work. Yeah. So we need to scale up the capacity of our platform to allow our people to handle remote work in an efficient manner, because a lot of times people when you are in the knowledge industry, you need to actually meet together, and this meeting of minds are the ones where you can get this exchanges of idea and growing of innovation. How do you have that kind of environment if you are now forced to work remotely? So some ways, innovative ways needs to be developed, so that you can, despite having a working environment which is now remote, despite all that, these minds can still come together and can still spark innovation and still can reach organizational goals that has been set by the organization. So this is something that the organization that is quite quick to adapt to this new norm would need to be very aware of, and they need to allow the people, the employees, to have the right tools for them to work efficiently remotely. So this is the kind of things that the organization in the country as well as the rest of the world have got to be be quickly conversant in, unless if you want to be ahead of the competitor. Yeah. So these are the kind of things that even us in the at the national level in the ministry have got to change the way we conduct our interaction. And in the medical fraternity, it is quite common for us to go present our findings and discuss our findings and in some conferences, and have this very small group of advisory meeting to iron out some of the issues. But now it is all done remotely. Previously, it is all done one-on-one, but alhamdulillah, with this pandemic, they have made sure that we are forced to use this new kind of interaction. And although it is quite challenging to use this platform initially, but in times of need, I think we have actually overcome this these difficult issues, and at the moment most of our discussion at the international level are all done via video conferencing. Okay, those are something that we need to consider. Remote work would become something like a norm, yeah, not only at the international level, but even at the societal level and individual level. And a lot of times now, even when we are doing interaction with our family members, it's now Google Meet, it is Zoom meeting, and even for prayers and some religious gathering, it is all done using remote technology. So this new norm of working remotely, new norm of interacting remotely with our colleagues, with our family members, it seems to be the way to go, and it will be the new norms for everyone in the world post-pandemic. So because of all of these changes, there's another set of issues that we are seeing within our community, which is our mental and spiritual well-being. Yeah, a lot of these changes are difficult, and sometimes we could not anticipate some of the new stresses and how would it impact on our workforce and also our family members, because human beings are very social beings. They need to interact with one another, they need to speak to one another so that they can make sure that they have got this connection with one another. And stress is something that is something which we are beginning to see when we have got to be separated physically. And these are some of the things that organization would need to look into. How do you maintain employee well-being when you got to interact over a long stretch of period remotely only? So these are the kind of new norms whereby people would need to be very innovative in coming out with tools whereby employees can interact with one another, and making sure that people are being well taken care of, that they are being appreciated despite not being interacting with the employees in a close manner. So some of this matter needs to be looked into, and sometimes the use of apps whereby people can assess their mental health and their psychological well-being are being developed to help employees have a sense of being appreciated. So making sure that the employees are not being left behind, and because some employees are a bit more introverted, versus others who are maybe able to handle the stress of working remotely. So you got to take into account the needs of these different expectations of the employees, so that the stress and anxiety caused by this new way of working are being handled well. Because if they cannot cope with being away from support, sometimes it's going to be counterproductive to the whole organization. So that's among the things that the paradigm that we have got to embrace within this short period of time as we deal with the pandemic. So I think these are very uncertain times and very unprecedented time that the pandemic has set upon us, and it is something that a lot of us are not very well prepared. At the Ministry of Health, we are seeing the dynamics of the pandemic as it evolves from the original pandemic of the 2019 COVID-19, meaning that SARS-CoV in 2019, and when it went into 2020, and when we still don't see the mutation of the virus, but as we enter 2021, we see a lot of the mutations that is taking place in the virus, and it has brought different challenges to every one of us. Now we've got the alpha strain, beta strain, right up down to the kappa strain as well. And at the moment, the delta strain is a new virus if you compare it to the earlier, the Wuhan strain, and it has actually given a lot of us and a lot of our countries all over the world, a lot of the countries all over the world are also seeing the impact of this new strain of the Delta strain of the virus. So these are the kind of things that we need to be grappling with over the next couple of months, and I hope it's going to be not too long drawn, and it's going to be us living with the virus next. And I think with the vaccination work that we are doing, we are seeing the light at the end of the tunnel, and hoping to hear a lot more good news with the advent of new drugs which is being developed to handle the pandemic. But it is still very uncertain times at the moment. We do not expect the numbers to come down drastically anytime very soon. But I think in the couple of weeks, I suppose, looking at the rate of vaccination, and also looking at the trend that is being observed in the other states that has ramped up the vaccination, we, inshallah, are going to be in a better state rather than compared to the current situation today. So I think that is what I wanted to share with a lot of you today. I think my other colleagues are going to probably give a bit more detailed account of what is the immunization program and how have we gone about with looking at the vaccines, and what are the challenges that we have in store. And I think we are going to do it okay, but the message that we want people to be to impact on the people, to impart on the people, is that it is not something that Ministry of Health can do alone. It is something that everybody of us in the country needs to come together. It is not a frontliner being in the Ministry of Health anymore. I think the people are now the front lines, in the front lines together with the government. We need to come together, because if we are going separate ways and not being together in the whole thing and looking at only the negative side, we are not going to come out of this pandemic stronger. But I think together we can be stronger. August is the Merdeka month. I think let's come together demi negara, demi Malaysia. I think we need to lindung diri kita so that we can lindung negara kita, and we can, insyaAllah, merdeka bersama in a very short time. I think with that, I thank you. Just like to remind be reminded by this verse by Inna ma'al usri usron, inna ma'al usri usron. From daripada kesusahan, you're going to have, some ease. So it's going to come. Walal akhiratu khairul laka minal ula. The end is going to be better than the beginning. This is some challenge that we've got to face, but we are going to face it together, and we are going to, win over, inshallah, with a blessing of God. Wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you for your attention.
Dr. Arif, do you have any comment?
I've got a very detailed slides. I think my colleague is going to present on the vaccination program. Probably that in another session. I'm just going to. I'm just presenting the off-cuff what's happening in the ministry at the moment. It's quite a challenging period. People must understand that when we are dealing with an unknown pandemic, we play as best we could given the circumstances, and the balance of life and livelihood is quite difficult. Ministry of Health are not doing the decision alone. When the issues are presented to the National Security Council, it has always been this balance. How much shall we make sure that the health is being, the life is being taken care of, versus how much is the economy going to be affected? So although the ministry would want the ideal scenario whereby the whole measure of public health intervention is strictly adhered to, but sometimes it is too costly from the economic side. So that is when adjustments are made. So adjustments are made, and it is being made at the National Security Council, and some of the discussion are not privy to a lot of us. Why is it that you allow a lot of these sectors to open up when you know that the virus is in the community? But people need to understand that it is a balance between the two, and finding the right balance is not something. It's not in the playbook. It is something that you learn as you go along. And I have got my colleagues in the hospitals. Some of them have not slept for days. Sometimes, when they are on call, and sometimes if we are specialists, there's only one or two specialists. They need to be on top and on call, 24/7. Some of the nurses, they are working like, double shift is normal. It's the norm now. Previously, we are also understaffed in a sense. They work 2 shifts, but now everyone works 2 shifts, 12 hours. Sometimes they cannot, take a break. They have to wear pampers. If you are in certain scenario, you cannot leave the patient. So they're very stressed out. But Ministry of Health, because our doctors are very dedicated, our nurses, kudos to them. They are doing their level best, and the numbers are high. But it is something that we have, we need to handle. And I think we are hoping for better days with the numbers coming down. We are quite confident that it should come down. And with that, I think probably it will give some breathing space for our frontliners. And we just hope that the people are going to take up the call from the government to get vaccinated, and make sure that we still keep some measure of public health intervention still in place before we arrive at the herd immunity. But I think we are seeing better days ahead. So it's not all gloomy, but we are still positive that we are going to overcome this. But we need to overcome this together. Yeah. So, Professor, that's what I'm going to share with you today. I'm supposed to be in the Parliament, so I'm here with you all because passing this message that this is something very important. It's something that unprecedented, but we are going to. We've done this before. We've got the case down to 0. But I don't think we're going to get the case down to 0 anymore because it is endemic. It's going to change from a pandemic to an endemic, just like living with other viruses in the community now. It's going to be like that. But as our people develop immunity via vaccination or by infection, you're going to see that we are going to be better able to cope with this coronavirus.
Okay, thank you, Datuk. Thank you, Datuk, for your very interesting and informative keynote address. In summary, Yang Bahagia Datuk has broadly elaborated on the current situation of COVID-19, especially in Malaysia scenario. Datuk had touched on few challenges that we face. Among others are new paradigm in conducting conferences, meetings, and for us in university, teaching and learning through virtual and web conferences. Second, Datuk has touched on the impact of COVID-19 on the livelihood of the people in terms of economical and also mental and social well-being, and issue related to the national vaccination program. Once again, thank you very much, Datuk. We have learned a lot from you. Now I hand over to the Secretariat for the next session.
Thank you, Dr. Hisham bin Muhammad Ibrahim, for a very insightful presentation, and also thank you to Prof. Mahdia Dr. Harif Fazilah bin Cik Hashim.